had power, not knowing I have no power. Anyway, to get back to the whole sleeve thing, they would not pay for it, the $100 one. Happy to pay for the $400 and some one, not the $100 one. So I ended up getting them to pay for it, and a few months later, I got a check from Anthem. The check was for 3 cents. Now, in my 4 visits to Anthem, and since I'm not happy with the recent reimbursement yet, I'll be down there on Friday, I learned that they do approval first at Anthem headquarters. Then they get some other kind of approval somewhere else, and they outsource the writing of their checks. So not only did they probably pay full postage, but I would bet it cost them anywhere between $10 and $20 to send that 3-cent check, which I will never cash. Anyway, I think I've covered most of it. Finally, yeah. Part of the rhetoric that I hate, and unfortunately our Representative Cantor is famous for this, is he says, oh, we don't want a government bureaucrat between you and your medical health and your medical care. What I've just told you is I have had a constant battle and therefore a corporate bureaucrat. And it's never just one call. It's always 4 or 5 in an appearance, or 2. My oncologist told me that in her practice she employs 3 people and their only job is to fight the insurance companies. Now how do you think that affects how much she charges? And that's basically all I have to say.
Thank you. Here in this room needs to know about for your wives, your sisters, your mothers, your cousins, your nieces, is House Resolution 1691. I'll give you that number again. HR 1691. That bill is the Breast Cancer Patient Protection Act. And what that bill says is, when a doctor performs a mastectomy on a woman and says she needs to stay in the hospital for 48 hours, she needs to stay in the hospital for 48 hours. Health insurance companies are attempting to make mastectomy operations outpatient procedures. All right? So please call your congressman, whoever they happen to be, and ask them to support HR 1691. You want breast cancer patients to get the stay in the hospital that they need to recover. I've had a number of women talk to me about fighting to keep their daughters or their mothers in the hospital after the surgery, where the insurance company wants to send people home with tubes. Once you wake up, you're good to go. And we all know that is just not true. All right, now, our next panelist is Dr. Lurla Joseph, who is currently a practicing physician. Lurla.
Good evening. It's really nice of you all to come out this evening, and it's also nice that we don't have banners and signs and screaming people, and I hope this evening will be an opportunity for a dialogue about health care. This has been a long, hot summer, and it's been a very confusing summer. Because there have been many town halls. I'm a small employer. I practice medicine, and there have been a lot of distortion about why we need healthcare reform in the United States of America. First of all, I'd just like to remind you some of the reasons we need healthcare reform. Right now in America, it is costing us too much to provide healthcare. And the health care that we're providing is not covering everyone. We have 47 million people who are uninsured. And last year alone, 80 million people went without health care. It is costing us too much. Right now, we spend about $7,000 per person. However, the average insurance premium for an American family is $16,000. It is costing us too much. Half of all bankruptcies in this country are medically related bankruptcies. That is, an unfortunate person who became ill, oftentimes not by any fault of their own, end up with a serious health condition. And their insurance runs out. Oftentimes, it doesn't cover the entire cost, and many times they are dropped from their insurance company because of their health status. That is one of the reasons we need health care reform in this country. When we talk about not having access, 47 million people not having access, we actually have two parallel systems of health care in this country. If you're fortunate enough to have a job and your employer covers your insurance, then you may have a fairly decent plan. But what we've seen is that the out-of-pocket costs for each person who has insurance has continued to escalate over the last several years. Now, I've been practicing medicine for 29 years. When I first started practicing medicine, HMOs were just beginning to make a significant impact in healthcare delivery. One of the theories of allowing HMOs and subsequently PPOs to enter into the healthcare market was that they would drive down the cost of healthcare. At that time, our gross GDP healthcare was averaging about 10% of the GDP at that time. We're now at about 14%. Healthcare cost is rising faster than most people's wages. It is costing us too much, and not enough people are covered. When I speak about a parallel system, in 1964, Medicare and Medicaid covered the elderly, the poor, usually children, and the disabled. Since that time, we have developed a myriad of community health centers and free clinics. So, and then we got EMTALA so that people can go to the emergency room and be seen. And so we have a wide array of financing healthcare. We hear about cost shifting. So if you should show up into the emergency room and you don't have health insurance, and your bill will be 100%. You have to pay 100%. If you have health insurance and that insurance company was able to negotiate a different rate, then your rate would be much lower. Where is the fairness in a system where you don't have health insurance, you may not have a job, you pay 100%, and someone else may pay 50%. So we have a very convoluted system that is just costing us too much. The other reasons for health reform is that it is not fiscally sustainable. You can private practice, and I believe it's a moral right for every person to have health insurance. So I can't legitimately have people working for me and not provide health insurance. It is costing me more and more, and as a small employer, I have about 12 people working for me. My rates for my staff is much higher than some of the larger corporations because I don't have negotiating power. So in essence, I'm really subsidizing the larger companies. And I will give you some figures about what my healthcare costs have been over the last several years. So this summer has been a very hot summer. We've had all kinds of accusations about what healthcare is going to be. And I just like to address some of those myths right now because we need to be serious about this. This is life and death. Every day, people are deciding whether or not they will take their medications or whether or not they'll pay their health insurance premium. They will decide if they're going to come to the doctor or whether or not